everyone, welcome back to my channel Navjot Talks. My name is Navjot. I'm a registered nurse based in Ontario. In this video, I'm going to give you some tips that you can use when you are new in the nursing field or you just moved from your back home and you got your license. Now is the time that you have taken your first baby step into Canadian nursing profession and you are struggling. These tips, they will help you to be more confident, to be more skillful, and they will help you to communicate with the fellow nurses or with the other healthcare team members. So whenever you go back and check the days when you started your nursing career, doesn't matter what country that was, you will notice one thing, that your first days were always challenging. You faced those challenges, and then there were days when you were so expert in tackling all those challenges. You were so expert in communicating with the other healthcare team members. The one trick that worked in everyone's case, including you, me, and everyone, was to be patient, have patience, and then learn. Learn from your fellow nurses, learn from more experienced people. Right? There will be days when you will be expert. There will be days when you will be very confident. It's not that you don't know the skills. Sometimes the lack of experience working in a familiar environment also imposes a big challenge on our mind. Same thing happens when you are new into a profession, or if you're a new person, if you're new in a country that you have never been into, right? You will always find it more challenging because you will see some faces which you have never seen before. You will see the instruments, the equipments, they are really different. That will just causes a little bit of chaos in your mind because you will find it challenging. In your mind, behind, at some point there will be a memory that has skills stored, but you need some sort of spark that will be an ignition to that memory, and that will trigger, and the response will come. But during your first few days, you will find that whenever you try to show your skills, you don't find those words, right, that you can communicate very effectively because you don't know how the other person will be. It has nothing to do with the skills. Sometimes it's just the confidence that's required to communicate. When I started my journey as an RPN, I was also not that confident. I was also getting panicked during my first report because I didn't know who will be the person that I will be giving report to. I don't know how much experience they have. I don't know if I am using the proper words while I'm communicating with them when I'm giving them the report. That all will come. And I am also going to request the other experienced nurses just to have some patience, because the people who are new, if you are getting report from them, you have to give them some time to think and then take an action, to think and then talk about what they want to share with you. Because if you don't have time, and if you are showing that you don't want to listen to them, they will lose the confidence, right? Everybody starts at some point, and we have to help each other. Nursing is such a noble profession, but we are somewhere we are losing that connection with other team members because of a lot of factors. Workload is high, salary is less some of the places, the nurse patient ratio is not that good. So all these factors, they contribute, but we have to be mindful because we all are healthcare professionals, and today someone else is struggling, tomorrow it can be your turn, my turn, right? Everybody is growing in one way or the other in their career. So if I want to grow higher in my life, and it will be my first day in another role, right, in another title, then I will also be getting panicked. But if my other fellow members, if my other seniors, they don't have patience to let me speak, to let me think and then give them the report, I will also lose confidence. Same thing happens with everyone. Doesn't matter if you're starting as an RPN, if you're starting as an RN, or you're starting as a manager. You need time to think and then talk to your other co-workers or other healthcare team members. Number 2, the tip that I want to give you is to have little diary. So in that diary, you can write down what you have to speak, and there's no shame in saying that let me take out my diary and then I'll give you the report. Not everybody has good memory. Not everybody is that capable to store data in this brain and then use it when it's required. That's why we have pens, that's why we have papers, because not everybody is able to retain everything in the brain. Our brain is not computer. Some people are good in recalling the information, some people are not good. So there's no shame in saying that I want to take out my diary and then we'll give you the report from there, right? It just helps you to be more organized. When you are doing your work throughout the shift, start making some little notes that you think is important to be shared with the nurse who is coming in the next shift, and then use that. Number 3, feedback. I have seen that nurses, they struggle, but they don't communicate with their seniors or with the senior nurses that this is what they're struggling on. If you are struggling on anything, I would ask you to ask for feedback. Feedback is such an important tool. We always think that performance appraisal is a tool that the employer will use, or if it's a tool that's only used when they have to measure your performance. That's not the whole story behind the performance appraisal. That's not the whole story behind the feedback. It is also an important tool that the nurses, the employees, they can use, the junior employees, they can use to get feedback, to get to know what are the skills that they are lacking, what are those skills that they need to work on, right? After 4-5 days, start asking one of your senior nurse or the nurse who you think is very experienced, has a good relationship with you, right? And start asking them, do you think there is any need of improvement? Do you think, where should I be improving? Are you okay with the way I give you the report? Do you want me to change my way? Because communication is the key. If that communication is not there, things will totally turn into a different situation, and sometimes you don't even know that somebody is thinking in that way, and you will only come to know when it gets worse, right? Number 4 is be respectful. Doesn't matter if a person in front of you is your senior, junior, co-worker, supervisor, or a student. You have to be respectful. If you're respectful, your tone is okay. If you're polite, people will respond really differently. Instead of reacting, they will respond. And this is also one of the tips that I will give you. You have to respond, not react. When you start reacting, you will not be able to communicate effectively. If you are responding needs time. You have to think, you have to process the information and pick up the words that will really be helpful. You have to start responding, not reacting. Reaction is out of your nature. How is your nature? How is your personal nature? How you perceive the things, that leads to reaction. But on a professional platform, when you are working in a profession that deals with public, you have to respond, not react, because response comes from the brain. The reaction comes from your nature, your personality. And if you start responding, trust me, that will become a part of your personality, that will become a part of your nature. And then soon it will turn into how you react. I mean, the response and reaction, there will be no difference. Right? But now at this moment, if I tell you somebody posts a bad comment on my video, if I say, oh, I don't feel that they should be putting some kind of comments on my videos that are offensive, then I might react. But if I have to respond, I will say, okay, out of 100, if 1 or 2 are behaving in this way, it's okay. I have to respond. I have to think. People are watching. People are looking at that response. It's just an example. I'm very lucky that nobody has ever left any negative comment on any of my videos, but just an example, because this was the easiest and simplest example that came into my mind to give you. So start responding. Another tip, always keep on improving your knowledge. Even if you have master's degree, even if you have a degree on a very, very high level, if you have reached a certain limit or a certain title that was your dream job, you still have to keep on learning, because there is no age for learning. There is no age for increasing your knowledge. There is always room for improvement. So if you show your other senior juniors that I want to learn, they will also help you, right? But you also have to share with them what you have learned. And this is one of the responsibility also. When you're working in a sector that deals with public, it's one of your responsibility, because nursing is evidence-based practice. If, for example, one of the tool that you used and you know that it was effective, start sharing that with other people so that they also get benefit. And when people they come to know that you are such a good nurse that likes to share your skills, likes to share the knowledge with other people, they will also come forward and teach you, right? Sharing is caring, we always say, and this is such a profession where the whole point of nursing is to care for others. And it's not always the residents, it's not always the patients, sometimes it's the other co-workers, sometimes it's other fellow nurses, right? You spend 8 hours of your day in a workplace, and you have to make sure that your team members, they are like your family members, right? It's your second family. You don't have to make those personal connections at work, but also you have to be mindful that you spend 1/3 of your whole day at workplace. You want to keep it as smooth as possible. You want to keep that harmony at work so that nobody feels bad. There is no negativity, there is no negative aura at workplace, right? All these things will happen when you take a step. You will take a step, people will take a step too, and then we will see that the culture will change, the work environment will change, right? It takes days and days, sometimes years, to change the workplace culture, to change the environment where we are working. But you have to be careful that whatever you are doing, you at the end of the day should not be feeling guilty that somebody did that to me, so I had to react, because at the end you are taking some skills away from that place, right? And you have to be mindful what you're taking away. You don't want to take any negative thing away from there. You have to take positive. You have to build yourself with positive attitude. You have to build yourself with the skills that you're meant to learn, right? So keep these things in mind, and then you will see the change will come. 2 days ago, I was looking at the videos that I used to post like 5 years ago. I was shocked. Some of the videos I just wanted to delete, like how I used to communicate. And then I was thinking that this is learning. Like I started from there, and today the way I speak, the way I share the information with you, little slowly picking up good words, that comes with time, that comes with experience, and that comes with when you have experience working with people. You see how they speak, how they talk, what kind of what kind of personality they have, how they put the things into words, right? You learn that. The more you communicate, the more you learn, right? See you in next video. Till then, take care, and don't forget to subscribe to my channel. I have created this channel only for you. I'm fully dedicated in my non-working hours to help as much as possible. I want to help my fellow nurses, my friends who are coming from overseas, who want to grow in their career. I am willing to help, and you can always follow me on LinkedIn. In case you are wondering if I'm using social media, I use Instagram, not too often, but I use LinkedIn. I'm very active on LinkedIn. You can subscribe this channel so that you know when I'm posting a video, I'm uploading a video, you will get notified. Press the bell icon, but on LinkedIn, so that you see how my journey started and what kind of courses I'm doing. A lot of courses that I'm doing are also free. You can always go and see what courses I'm doing, and you can also do those courses. So please subscribe to my channel and then follow me on LinkedIn. Okay, I'll see you in next video. Till then, take care. Bye bye.